On this episode of the Co-Conspirator Track, Liz Beaulieu, the editor for HME News, joins us. And in just 13 minutes, we discuss her favorite highlights from the HME Business Summit, what strategically worked well for operators in 2025, and the biggest storylines already shaping 2026. And this conversation starts now. So Liz, you just wrapped up the HME Summit a couple weeks ago. Can you give us a quick overview of what the summit is and what makes it unique in the HME space?
Yeah, we hosted our HME News Business Summit a few weeks ago in Cleveland. Our kind of niche in the events world is to provide that bigger picture education and kind of close-knit networking opportunities. So that tends to draw an audience that leans more C-level with lots of thought leaders and decision makers in the room. And this year's summit was our most well attended in recent memory. We actually had to close the registration a couple weeks prior to the event. So it was definitely a great event, not only from an attendee perspective, but also from a sponsor perspective. We're super appreciative of all the support that we've received from the industry for this year's event.
So what would you say are the 2 to 3 biggest storylines you're seeing as we close out 2025 and head into 2026?
When I think about what people were talking about at the summit and kind of what we've been covering, in HME News, but at the summit particularly, what I think are huge shifts in provider operations. So the these conversations came in a few flavors, right? But the two that stick out are adoption of technology. So all those buzzwords, artificial intelligence, large language models, automation. So that's a big one. And the second one was kind of this response to a rise in consumerism in just the general healthcare world, in our everyday world too. On technology, I thought it was really interesting. We had a panel of investors and venture capitalists who have invested in tech companies in the industry. And one thing that I thought was interesting that they said is that the importance of picking the right partner. So it can get overwhelming, I think, right now, the number of companies out there that are saying they can, re-engineer how providers kind of approach intake and billing. There's a lot of them. And this panel really recommended putting these companies' feet to the fire about how they can actually provide ROI, right? So that was a big one. And also what their long-term roadmap is. You want them to stick around and you want them to keep innovating, right? They also offered some insight on how that market might shake out, and how we might see a shift from some of these kind of isolated point solutions to more integrative platform systems. On the rising consumerism, I thought Joe Megabo from CPAP.com really pushed providers to rethink where they get their business from. I think the HME industry for so long has been so referral-based focused, right? But with consumerism on the rise, providers are missing out when they don't consider consumers as a referral base, right? And so his big thing was that providers need to be better about building demand for their services. Sleep's a good example. 6 million are diagnosed with sleep apnea, but potentially we're talking about 30 million people who have sleep apnea. So those are the two things that kind of stuck out to me.
So it's very interesting you brought up the investor panel and the intake and billing kind of conundrum of, you're right, there are a ton of different solutions. Beaulieu being one of them. We're saying that we can provide both on the intake and the billing side, automation there, and leveraging AI to make that process much smoother for providers. But you mentioned a term there, an integrated platform. This has really been Beaulieu's approach to it as well. And one problem that we think we've seen is you solve the intake problem, but there's a lot of other opportunities to automate, a lot of different workflows all the way from intake to billing. There's the in-between, right, is what we call it, between intake and billing. And I was just curious what you thought of that and unpack that a little bit for us.
Yeah, I think the analogy that Peter Siegel, who's an investor in Parachute Health, provided, his firm is, I think, also an investor in Shopify. His example was, Shopify didn't really take off until it became more of a full stack, offering. So I think, anecdotally, he offered that as an example of like where, the market might be headed.
What are you seeing is actually working well for HME providers? And yeah, can you kind of just unpack the strategies or approaches that seem to be gaining some real traction?
Yeah, I'm going to sound like a bit of a broken record. I'm again here, I'm going to say, adoption of technology. Even if the industry hasn't adopted these new tools in large numbers, there's a sense or a feeling or sense of excitement that they're more open to it. And I think they realize they have to be. One of these tools came out of stealth mode at the summit. And I was surprised to hear at the event that a number of providers were already using it. And that was part of their go-to-market strategy, right? Like they had worked with a handful of providers to really, test the tool before kind of officially launching. These providers were kind of buying what they were selling, right? I think there is more of an openness to it, which I think will work well for the industry, right? The other thing I think that's working really well in providers' favor is the service they provide to referral sources. So this is interesting. The industry talks a little bit about patients and the service they provide patients, which is super important, obviously. But I thought it was interesting. We had a fireside chat with a couple doctors at the summit. And, one of those doctors said that he gravitates toward companies that give him the best service, right? They communicate regularly with him. They educate him on the increasingly difficult to follow payer criteria. They provide them not only with data, but also context to help him interpret that data or, put it into context. So I think those things, and I think most providers do that well, but I think it was a good reminder that, you're also providing service to your referral source, right? Not just the patient. So I think those are two things that, came up at the summit that I felt like, okay, we're like, the industry's doing a good job with these things.
So you don't think that there's any resistance anymore? You think it's just pretty well every provider's like, yeah, let's go, let's jump in. I just need to find the right partner.
Yeah, I think it's less skepticism about the tools and more a feeling of overwhelming that like, okay, now which direction do I take? So I think to adopt these tools is not a small thing, right? From an implementation perspective, from a cost perspective, from a culture perspective, it's a major undertaking, but I think we are shifting a little bit more toward realizing that it's something they have to do.
Yeah. Well, preaching to the choir here a little bit for us at Beaulieu, but I agree. I think that for far too long, technology providers, just over the years have made it too hard to adopt or too hard to test, and it should be, every other widget and SaaS and software and provider and in any other industry, there are really great 30-day trials. There is a very low resistance to trying something out, but and I know it's because of the complexity of what providers have to go through, talking about the payer guidelines, talking about competitive bidding, talking about the compliance issue, right? So there's definitely some safeguards that have to be there, but overall I do agree that it's too difficult to try things out. So transitioning to the challenge part of things, on the flip side, if we're really bullish about technology and AI and excited about the massive opportunity, a little overwhelmed, like you said, but what are the main challenges they're facing right now?
No, I think, based on the conversations at the summit and what we're writing about most at HME News is, competitive bidding, first of all. Having said that, I don't feel like it's the same industry as it was even in 2021, during the last round of the program. And even during that last round of the program, CMS had to scrap, most of the product categories because it didn't see any savings, right? So, and I think we'll have even more sophisticated bidders this time around, right? So I think, we'll see that again. And we have technology to what we've been talking about in play in a way that we didn't have even a few years ago that will help providers hopefully navigate some of this reimbursement and policy pressure, right? Still, it's a huge uncertainty, especially as we're recording this. We're still waiting for CMS to kind of publish some final plans for the program. So we still a bit of an unknown, but when you think about the next 12 to 18 months, we'll definitely know what that program looks like in more detail, as well as the outcome of it probably, and potentially even an implementation. The second one is contracting trends, particularly involving, the larger providers. And I think that started a couple years ago with Adapt and Humana in 2023. And then we saw United Healthcare and Synapse in 2024. And then this year, we've kind of seen that accelerate. I mean, Adapt just announced, this past week in their earnings results that they have another capitated contract with a major health insurer. Earlier this year, they also announced a capitated contract. And then we've seen Apria and Byram, announce a preferred provider agreement with Optum. That story is one of our most read for the whole year. So that, is definitely something that's on people's mind. We're also seeing increasing number of joint ventures between large providers and health systems. So, like Equipped Home Medical, they've been pretty open about their strategy of kind of embedding with health systems through acquisitions of their DME operations. So closed contracts, I think, have always been a concern for providers. And I think that's even more so now. We polled our readers about this recently, and I think 60% said that they're seeing more of these contracts and JVs in their areas. And then 73% said, they don't have these kinds of agreements, largely because they don't have the opportunity or the resources. So those are the two biggies, as I look at what people were talking about at the summit, and also what we're writing about and what seems to be the most read.
Yeah, absolutely. So to end on a high note, though, I don't want us to go out on the problems we're facing, but what, as you reflect on 2025 and then going into 2026, what has you most excited or optimistic about the industry?
Yeah. Again, technology, where the tech companies in the industry are going to take their products next, and how and where and how providers will adopt those technologies. I think that's exciting. I'm also, when talking about competitive bidding, it's exciting to see the industry coalesce in a way around trying to shape that in a way that I haven't seen before. Like Home Care and VGM, they've been working diligently, to position the industry in the best regulatory and policy landscape, right? But with another round of competitive bidding, they had a big fundraising to launch a campaign to really kind of potentially delay or at least shape what this next round of the program looks like. And that to me is like a whole different vibe, which is nice to see. And then just generally, I feel like the industry has a real window in the next 12 to 18 months to do a lot of things differently, again, generally. And I think that's scary in a lot of ways, but it's also exciting. So I think it's a very interesting time to be in the HME industry.